first is the plumb line assessment. Here's my plumb line. Anterior view, posterior view, sagittal view. And then there are 5 different deviations. The first deviation is the ankle pronation supination and the effect on the tibial and femoral rotation. And for that, the trainer or coach should go to the client's ankle joints until it is positioned midway between both palms. So we're going to do that. So here are my ankles. And I want to position my ankle right in between both palms. And if when I relax my feet, if my foot collapses somewhat inward, it is indicating that I have a pronated position. And if my foot collapses outward, then it's a supinated position. So here, I'm going to relax my foot and pretend it was going inwards. That would be supinated. And say my ankle would go outwards. That would be pronated without lifting any of my toes. The next assessment is going to be the hip adduction. So, I forgot to say, for the ankle supination and pronation, the muscles that would be tightened would be the calf muscles and potentially limit the ankle dorsiflexion for the ankle to move. So the hip adduction is progressively lengthens and weakens the hip of the abductors on the same side that the hip is adducted. So for the hip adduction, it defines a lateral tilt of the pelvis that elevates one hip higher than the other, which may be evident in individuals with limb length discrepancy. So if the person raises the right hip, which is this hip for B, raise it, the line of gravity following the spine tilts over towards the left, moving the right thigh closer to the line of gravity. So consequently, the right hip is identified as moving into adduction. So this position progressively lengthens and weakens the right hip abductors, which are unable to hold the hip level. So sleeping on one side can produce the same effect, and I actually usually have this because I have one leg that is longer than the other. So this is my dowel. I'm placing it to determine the level of my pelvis, and if it's at a straight line, then I have normal hip position, and then if I have right hip adduction, then my right hip is going to be moving up, and then this tilts to make it look unlevel. So the plumb line should pass through directly down in the anterior view in the middle of the sacrum, which is right here. So the next deviation is going to be the hip tilting deviation, anterior or posterior. Anterior tilt would tighten the muscles. The tight muscles would be the hip flexors and the erector spinae, and then for posterior, the tight muscles would be the rectus abdominis and the hamstrings back here. So we're going to do this with the sagittal view. Say that I'm standing this way. I'll move it a little bit down so you can see. On the sagittal view, a regular hip will go right down the middle, down the sagittal view, straight. An anterior pelvic tilt would be where my pelvis tips this way. So I'm tipping my pelvis, and the plumb line goes diagonally, kind of going from back here to up here. And then a posterior pelvic tilt would be where I do this, and my plumb line goes down here, back here. The next deviation would be the shoulder position and thoracic spine. So the shoulder position and thoracic spine, its compensations due to the movement at the shoulder, frequently due to complex nature of shoulder girdle design, so everybody's a little bit different. And then what we're going to see is that the shoulders are level when it comes to the plumb line. So here's my dowel. I want my shoulders to be level, just like this. And there are a few different deviations. So if the shoulders are not level, then the muscles that would be tight would be my upper trapezius right here, my levator scapulae, and my rhomboids back down here. So in the asymmetry to the midline, would be, say, my lateral trunk flexors, flexed side, so we can see it this way. It's a little bit hard to see, so I'm going to stop.